Hey there, everybody. My name's Alex Andrew.
And I'm Dr. Shasta.
And we're back with another episode of Your Healthy Living here in wonderful San Jose, California.
Yes, this is the epicenter of happy, healthy people in general. They found this like one of the happiest, healthiest places in America.
And Santa Cruz is kind of like that,
Yeah, and Santa Cruz, too.
Don't you think?
We have Dr. Lonna Larsh with us today. She's a family physician. Welcome, Dr. Lonna.
Hi, Dr. Larsh.
Hi, thank you.
How
It's
you
nice
doing?
to be here.
And she lives in Santa Cruz.
Well, there we go.
Yeah.
Right?
So take that.
Take that.
But I climbed to the top of the mountains at Philomontalvo and look at the bay, so I still get to see the bay every day.
Well, both sides of the mountain are pretty cool if you think about it. San Jose, Santa Cruz. You know, I'm kind of in that Los Gatos pocket. I love it. We just went fishing up at the Lexington Reservoir the other day.
How
Just
nice.
9 minutes, go and drop your line in and...
Well, Dr. Lonna Larsh is not too far for people to drive to from Silicon Valley. She is specializes in functional medicine, which is the medicine of the future. And being a medical doctor who does functional medicine, it's extremely rare. She is truly a treasure for everybody and the future of medicine, I believe, in America. So we're very happy to have you. She's the founder and chief medical officer for Roots of Health, a comprehensive functional medicine practice in Santa Cruz. As a family physician, and I've taken my son to her, she is interested in general health and how the parts fit together to create a healthy individual. However, she has special interests in gastrointestinal health, autoimmunity, hormones, and nutrition. She was born in San Jose, finished her undergraduate training at UC Santa Cruz, earned her medical degree at UC Irvine, and did her residency in family medicine at Contra Costa Regional Hospital Martinez. She is board certified in family medicine, integrative medicine, and recently completed the Institute of Functional Medicine certificate program. She organizes the Santa Cruz chapter of the Functional Forum, a nationwide group of healthcare providers interested in functional medicine. She has been married 27 years, has 2 daughters, a dog and a cat, 5 chickens, and she is just in general a leader in America here for us.
Oh, this
So
is great.
we want to know, what is functional medicine, and are there a lot of medical doctors becoming specialized in functional medicine?
Great questions. Yeah, so functional medicine, it's always surprising to me how few people know anything about it. So I think it's a great place to start. Functional medicine is figuring out what the underlying causes are of people's medical concerns. So whereas conventional medicine basically just puts a label on things such as diabetes, hypertension, whatever, functional medicine is looking for the root cause. That's why we recently changed our practice name to Roots of Health.
Oh, I get it.
I love
that's
that.
good.
Roots
That's
of
good.
health. And we're talking about health, not disease care, health care.
Right.
And functional medicine is about health care.
Well, and I like what she said about it's the wave of the future, because I think this is, and since I've met you, it's really helped me understand that there's something to this.
It really is the way medicine should be practiced everywhere, but so little of it is. It is becoming more and more popular.
Mm-hmm.
Dr. Mark Hyman is now running the Cleveland Clinic, their functional medicine program. So it's great that there is a,
And he wrote what book?
Oh, boy.
Fit for Life?
He's written a lot of books.
Yeah, he's quite remarkable. He's a really has helped a lot in understanding the nutrient value of food and what food really does. And how about Dr. Andrew Weil? Does he do functional medicine?
Boy, yeah, I think that you could say that he does. He's definitely an integrative medicine doctor.
Yes.
Yeah.
Well, we're going to be talking more about integrative and functional medicine here on Your Healthy Living. You're watching the KIYS Video Web Radio Network, the Kindness in Your Soul Network.
At Way of Wellness, we help to rebalance the hormones of your body so that it can heal itself. Way of Wellness offers acupuncture, Chinese medicine, functional nutrition, Qi yoga, and wellness coaching. Call 408-615-1995 and start living the life that keeps us well.
Hey, double hey, everybody. My name's Alex Andrew.
And I'm Dr. Shasta.
And we're back with Your Healthy Living, talking with Dr. Larsh.
Yes.
About-
From Santa Cruz, California.
Yes, and you know what? I love Santa Cruz, and I would come over there in a heartbeat.
It is a great place to come.
I mean, just to think, you can go down to the ocean right after you have your treatment or whatever. What a great
and the
way
air
to
is
do
great.
it. And this functional medicine thing, though, is always intrigued me, and integrative and functional and that kind of thing.
And conventional.
What's that
the
difference?
difference?
Okay, so
between these
conventional medicine would be like going to your regular doctor, your regular Western medicine doctor. Integrative medicine is a little bit different than functional medicine in that it's the parts. So like seeing an acupuncturist would be an integrative medical provider, seeing a chiropractor, seeing a homeopath. Whereas functional medicine is looking at all of those things together, trying to find the best modality for people. And again, looking at for the roots of people's problems. So looking at their digestion, their nutrition, how they're sleeping, how their hormones are working, how their detoxification is working. So all those different parts and putting it all together.
So you do more in-depth tests.
Yes.
To check, like a digestive stool analysis, saliva tests, blood tests at very deep levels. You check for B12 deficiencies and where you're not methylating, right? And things like that that could be skipped over.
Absolutely. So your conventional doctor is going to do some of those things. It's very normal to have them check a vitamin B12 level or a folate or something like that. But to have them look at all of those different pieces is not what's the usual.
Not the usual. And do you give supplements and herbs based on what you see, and then check in a couple of months to see how they're improving with those same tests?
Absolutely. So
that's what makes it unique, also.
Well, and one of the thing that makes seeing a medical doctor unique, because there are lots of functional medicine providers that are acupuncturists or chiropractors.
Yeah. Yes, I do functional medicine.
There
too.
you go.
Yes,
Yes,
as an
absolutely.
acupuncturist.
The thing that I get to do that a lot of other people don't is prescribe drugs if they're needed.
Which
you
is
do
great.
them judiciously.
Right, which is wonderful. So you can bring everything together.
That's what I try to do.
Do you take people from far away consultations?
Absolutely,
So
yeah.
from all over the country,
I
people
have
could.
patients from all over the country. I even have a
Yes.
couple patients in Germany,
Yeah.
far-flung
Because
places.
you could do it, yes. Well, tell us about the trajectory of your career. Why did you go into medicine, and how did you end up in functional medicine?
I'll try to keep it sort of simple and short. When I started out my college career, I really didn't know what at all I wanted to do. So this is a story for people who are lost and don't know what they want to do.
Yeah.
Yes, exactly.
Which are most kids, by the way. Right?
Yeah, because I was not like I was not the kid that wanted to be a doctor my entire life. I really didn't know. I didn't know any doctors growing up. So I started out in nutrition. That wasn't a fit. Then chiropractic. I thought I was going to do that, and that didn't work. And I ended up volunteering at the Santa Cruz Women's Health Center, and I just loved it. And I was
know where that is.
working with a lot of other kids who were pre-med students. And I honestly remember specifically being in class, studying for a test, and getting the realization that, if these idiots can go to med school, I could go to med school.
I love
They are just normal people.
Yeah,
They're just
they are
learning
normal
different
people.
stuff. Right?
Exactly.
They just follow through.
Yeah.
Right. So I did well on my tests that I needed to do to get into med school, and I did well in my classes, and just one thing led to another. I went to med school, loved family medicine, and then when I got out and started working in medicine, I hated the conventional medical model. It just did not work for me at all. So after doing that for 13 years, I left, started my own practice, and one thing led to another. And
So you were part of a big group.
Well known.
I was part of a big group. I worked for what is now Palo Alto Medical Foundation. I worked for Santa Cruz Medical Clinic.
So you were brave. You went off on your own. Didn't know how that was going to work out.
Right, yeah. I mean, in retrospect, they were great to work for. It just, the model didn't work for me, just the system.
Right. And what was it about the model that you didn't enjoy?
Well, those 10 or 15-minute visits, what you get
How
is...
much time do you usually spend with your patients on
So I
average?
usually spend at least an hour with my patients. My
Wonderful.
new patients are 2-hour visits. So I get to learn a lot more. I mean, really, with the conventional model, you just can't
Like
spend
push them
that
in,
kind
push
of
them
time.
out, push them
Yeah.
in, push them out. Yeah.
And I've recommended a lot of people to you because it's really hard to find a medical doctor that will take 2 hours with someone and really try to find the root cause. And I know that you do. So I just want to thank you for doing that.
Thank you, Shakti.
Yeah, because I mean, you may not make as much as you would have in a big, hospital, but the impact you're going to make is huge.
Yeah.
So
That's
was
for sure.
that was the transition then, just because into the functional medicine. I mean, did you learn about it before you got into that model that you didn't like, or was
No.
it something
How did
that
you come upon the functional
Yeah,
medicine?
so
what was the aha on that?
I left working for the Large group and started just doing regular medicine, but I wanted to do it where I had a little bit more, closeness with my patients than I could have in the big group. But I took a class through the Institute of Functional Medicine, and it changed my life. I was just set me on this whole nother path.
Oh my gosh, it is really fascinating.
I just never had heard of it before,
Yeah.
really. And
like our gut health for our mental, health,
that gut-brain connection.
gut-brain connection.
Yeah,
like, wow.
exactly.
It
If
just
we eat
goes
a lot of
deeper.
sugar, we might be depressed.
Hello.
Did you know that, unfortunately, suicide is number 10 leading cause of adult death now, and depression is rampant in America. And what you're doing and what I'm doing is so important, because if we can help heal someone's gut and help their serotonin in their gut, they can be happier naturally.
And that's why we're the Kindness in Your Soul Network here, to make everybody happier and aware that you have help.
Yes, that
Right?
there's natural ways to help heal your own body. We are a part of nature, and therefore the more natural things we do, the happier and healthier we will be. But we do need Western medicine. Western
I
medicine
agree.
saves lives, and we have,
All my family's doctors, so hopefully it stays
Western
around,
medicine's
because I'm going to have to support them.
amazing for emergency care, surgery, and some, diseases that need it. Like I have autoimmune hypothyroidism, and I need my thyroid medication, or my heart would stop beating, and it saved my life. The integration saved my life. So I'm very grateful.
And that's
love
why I think
Western
the
medicine.
future is really what it's
It's
all
a combination,
about.
but with this functional medicine.
Right. And I think the insurance companies are going to be a lot happier because people are going to be healthier.
Absolutely.
Right.
It's going to save
Save a
money in
lot
the
of
long
money.
run.
Right.
Yeah.
Why are you so passionate about this work?
I love it because it works. That's the biggest reason. I have seen people just really recover from their problems. So a lot of people come to me just saying that they don't feel good, and they don't know why they don't feel good. Some people come to me because they've gotten diagnoses from their regular doctors and they don't know how to deal with them. In both of those cases, just with doing a little bit of digging, we can usually find something to take traction with and to help change their diet, change how they move, change how they sleep. I mean, and it's really amazing how paying attention to the basics
This right?
make a huge difference.
Yes, it is. Isn't it?
Common sense. Wow,
Right,
who'd have
right.
thunk? Right?
Like, how much sleep do you get? Do
Yeah.
you drink enough water?
Right.
Is
Okay, 14 cocktails a day is not a good idea.
Is there board certification in integrative medicine and/or functional medicine?
There is a board certification in integrative medicine. It is through a different body of, I don't know, what do they call those people? The people that board certify you. There's through a different body of people than the regular, like your internal medicine doctor and your surgery doctor and that kind of thing. But there is a certification.
Yeah.
And then functional medicine, there is no board certification. So it is kind of important to check out somebody's training
Yeah,
before
really.
you go see them, because they might not really know what they're talking about.
And you have a functional medicine nationwide group of healthcare providers that you are organized. You've organized. Tell
Yeah.
us a little bit about that and how people could find someone in their area.
So the Functional Forum is this group that meets all around the country to talk, and they usually have some great speaker talking about some particular topic, and we all log in at the same time and watch this all over the country.
Okay.
It's mostly
So
providers.
it's a learning forum
Right,
with
yeah.
providers, which is wonderful because it's forwarding the medicine.
Yeah, so it's
Yeah.
doctors and acupuncturists and chiropractors all meeting together
Yeah.
to network and learn.
That's
really
wonderful.
fun.
Yeah, that's really
We're going to be right back talking more about integrative medicine
And functional
And
medicine.
functional medicine after this break.
I do traditional Chinese medicine, and that includes 5 different branches: acupuncture, massage, yoga, tai chi, qigong, herbal medicine, and nutrition. It is amazing in helping the body heal itself, that it releases the body's natural endorphins, serotonin, and seems to rebalance the hormones of the body.
Lower back pain was taken care of very quickly. 6 treatments and I was pain-free. And this was like 3 years ago, and I've remained pain-free.
I've grown up in the Bay Area, and I have had my own practice for over 15 years. When I was 12, I decided I want to be an acupuncturist, and by the time I was 25, I was licensed.
I have thyroid condition and stress, big time. When I walk out, I'm feeling like a whole different person. It's definitely a blessing to be able to come here.
I love helping women have babies, and the day that they actually get pregnant, the look in their eye is like, it's the best thing ever.
I've been struggling trying to get pregnant for the past 3 or 4 years. I came to Shasta. I would totally recommend her to anyone out there that is trying to get pregnant. She will do great for you.
Way of wellness has to do with living a life that keeps us well.
Hi there, this is Alexander with It's All About the Show. You know, I've been with Money Concepts since 1994, and they have been the primary catalyst for my success as a financial advisor. If you're looking for a career change and you want to help people for a living, check out moneyconcepts.com/ALEE or call 946-8378 today. Hey, double hey, San Francisco Bay, Monterey. My name's Alex Andrew.
And I'm Dr. Shasta.
And we're back with Your Healthy Living, talking with Dr. Larsh, MD, and functional medicine expert. Now, this is a little bit different. We were just talking before the break about how, you got to be a little bit careful about who you choose as a functional doctor. So how would a layperson choose a practitioner? I mean, what do they look for?
Yeah, so as I mentioned before, there are lots of chiropractors and acupuncturists and various practitioners that are doing functional medicine and doing a fabulous job. I think that because there isn't a board certification for it, you just need to ask them what kind of training that they've had and, ask them some sort of probing questions about what kind of people they've treated, if they have experience in treating your condition. For MDs and DOs, and actually for other practitioners too, the Institute of Functional Medicine does certify people, so you can go onto their website and do a search for practitioners in your area and find people who have done training with them, and it'll tell you how much training they've had too.
Well, what sorts of conditions are ideal for a functional medicine approach?
The things that I think are ideal, I actually mentioned these a little bit earlier, are the ones that I work with the most. So digestive problems, autoimmune issues, hormones, thyroid problems, and people who just, you listeners, I'm sure, or viewers, I have had this experience because everybody does. You go to the doctor with a problem. I just don't feel well. I'm dizzy. I have stomach issues, whatever. They do a little battery of tests and they say, "Oh, you're fine," and then you're gone. You never go back again.
Right.
So those people, we can almost always find a reason for it.
Right.
If you don't feel good, it's not normal. There's a reason for it.
Right.
And it's not all in your head.
And if 70% of Americans are overweight and half of them are obese, and we have a severe amount of depression and anxiety, and we've just recently found out that some of these Prilosec and Xanax and some of these anti-anxiety medications that are affecting the gut health are affecting actually suicidal thoughts and suicide. So someone like you, because you are an MD, you could actually work with their prescription meds also where other doctors couldn't.
Yeah, absolutely. I mean, most of the time
chiropractors couldn't. But you could work with their whole health.
Absolutely, yeah.
Which makes that very
most of the time
very
I'm trying to take people off their medication.
Right.
Honestly.
Yes.
But yes, I can work with them too.
So who would your ideal patient be in the sense of, do you work with children, teenagers?
Yeah, age. That's one of the things I love about having a family medicine background is that I like all ages. I work mostly, my peak demographic is probably middle-aged women.
Right.
But I love kids, and I also love working with the elderly. You know, it's just wonderful to have that whole spectrum.
That's great. And
And babies. Oh, I love babies.
oh, you love babies. Great. Well, that's good to know. What does a patient experience when they come to your practice?
Well, the first thing I have people do is we go through a very extensive history of their entire life history as well as their medical history. So that takes up, that's why we need 2 hours, because we go into that history in depth. Then we usually figure out what we always go into what they're eating and how we can improve that. We try to fix diet and sleep, and movement is always so important. And we figure out what tests to order, have them do stool testing like you mentioned, have them do saliva testing often. We check all the bodily fluids, basically.
Yep.
And then have them come back to review those, fine-tune the lifestyle, figure out if any treatment is needed as far as herbs or supplements or prescriptions.
Western meds.
Yeah, exactly.
And do you encourage them to have a team of practitioners?
Oh, absolutely. I mean, especially working in Santa Cruz, everybody has been to some kind of alternative providers,
Right.
So acupuncturists, chiropractors, craniosacral therapists.
Oh, I love craniosacral.
Aromatherapists, the whole...
Naturopathic doctors.
Yeah, exactly.
Yes, I know. Everybody should have a team.
Yeah.
We should, I mean...
I have to.
We have to, really. So do you work alone, or are there other practitioners in your office?
Oh, I have an amazing PA, a physician's assistant, who works in my office. She's also a licensed acupuncturist. Her name is Amber Weiss. And that's it, just the two of us.
Right.
We have
That's a great combination.
Yeah, so we recently moved, so we have a little bit more room. So we're thinking about maybe hiring a massage practitioner or something
So
like
you
that.
have a really comprehensive medical team in there. I just think that's the best. Are you accepting new patients?
Well, I have not been accepting new patients until very recently. I have this new model. I'm working with people, having them get basically get a program that includes their supplements and their tests and their acupuncture visits and their visits with me, and education and health coaching. That's the other thing that's so important. So we have them basically get a package of 3, 6, or 9 months of care.
Wonderful.
That is all inclusive, that can really
wonderful.
support people to improve their health.
And that's how long it takes.
It does.
I mean, that's what I tell my patients too. When it's a chronic problem, I say, listen, it's probably going to take up to 9 months. We'll be more aggressive in the beginning, but less and less as you get better. But it takes generally up to 9 months to really reverse things.
Yeah.
So I think that's just fabulous.
And so many times I've started people on a program, and then they just peter out.
Right,
You know?
and they don't really get to see the full benefit.
Yeah, it's just human nature.
Right.
Things get in the way, and then they don't want to come back because they're embarrassed because they haven't done what they needed to do, and that doesn't get them any better. So this way
they really
get better.
They commit ahead of time to the amount of time it really is going to take. That's really smart.
That's a great idea.
So how often do they tend to come in, or how often do you do the wellness coaching? Do you do this wellness and functional medicine care with distance phone consultations?
Yeah, so I definitely have lots of patients who are all over the country, and we do lots of distance Skype visits, whatever. But for the programs, it does make it a little bit more difficult to do acupuncture distance.
I bet.
Yes.
Is that why you have all those holes in your screen?
Right.
What's that from, right?
So we do we can always work it out.
Yeah.
But it does mean a little bit of moving things around.
Right.
Well, I mean,
right.
would talk to an acupuncture that might be in their local area to kind of coordinate what they need?
Very good. That's exactly what we do.
Okay.
Yes. That would make sense.
Right.
Well, I'm over here in San Jose if you need me. Yeah. So how does someone become your patient? How would they get a hold of you, and what's your, do you have a website?
Yeah. So my website is www.rootsofhealthsc.com. And there's all my contact information on there, but my phone number is 831-421-0775. And, that's how you reach me. Call me or email me, and we'll get you set up.
And as far as insurance goes, tell us a little bit about, how this is paid for and these packages that you're selling.
Yeah.
How people do that. Do they use their health savings account?
Well, that's because a lot of people
Right? A lot
are
of
concerned
people
about
have those
going to
these days.
somebody who's holistic or something along those lines. Like, well, wait a minute,
And
is
do
there a
you-
way to get reimbursed
Yeah.
or anything like that?
Yeah, it is a little bit more complicated with the programs that we're doing now, but it's not impossible. I give a super bill for all of our visits, so you can submit those to your insurance company to get reimbursed.
Right.
Hopefully,
And do a lot of these tests that you do,
a
do
lot
they
of
get
the
covered?
tests, a lot
Which
of the
is
tests
wonderful.
are covered. Exactly.
Because you're a medical doctor, if you sign off on it, they'll tend to cover.
Exactly.
Which is what makes you very, very special and important.
Yes, that's exactly
Yes.
right. Whereas, seeing a chiropractor or whatever, a lot of times it's not covered by
Correct.
insurance.
So they can get these more in-depth tests,
Yeah.
and their insurance will
So,
generally
so
pay,
the super
which is-
bill is all the bills put together, so you don't have to do this receipts. Is that
I
how
don't
that
know
works?
why it's called a super bill.
I don't
It's
know
Okay,
just
why.
this.
I was just trying to figure it out.
It has the
Never
diagnosis,
heard
her diagnosis, and her procedure,
Oh.
and the fee, so that it can be sent to the insurance company to be reimbursed. So
Okay.
generally,
It's
they're
basically a fancy receipt.
it's a fancy receipt.
Oh.
So again, you can be reached at www.rootsofhealthsc.com, and phone number is 831-421-0775. Dr. Lonna Larsh, MD, and she's a family physician at Roots of Health in Santa Cruz, California.
Santa Cruz, and where's that right off? Isn't that right off Santa Cruz Boulevard?
Frederick
That's
Street.
in Los Gatos.
No,
Santa
that's
Cruz Boulevard
Oh.
is in Los Gatos.
Santa Cruz is Frederick Street near downtown.
Yeah, you take
Oh, okay,
Highway
Highway
17
Right.
over the hill.
right.
Yeah.
Yep. But
Okay.
people can do distance consultations also.
Yeah, because we used to go to the TV studio down there that used to be downtown.
Yeah,
Now they moved
right.
around the corner. A good friend of mine runs it over there.
Cool. Yes.
Yeah.
Well, thank you so much for coming on our show.
Thank you for having me.
Yeah, it
It's
was
really
great.
fun.
Functional medicine. Remember that
Yes.
one. Thank you for that before the last break, though. I appreciate it. You've been watching Your Healthy Living. My name's Alex Andrew,
And I'm Dr. Shasta.
and you're watching the KIYS Video Web Radio Network, the Kindness in Your Soul Network. Check out our website, KIYSradio.com, or our Facebook. Give us a like, say hello, give us some stars. Have a great one. Take care.